And we're back. Thanks for joining us. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress. And here in my studio, we have Andy Neary. He's a healthcare strategist with the Olson Group. Andy, thank you so much for being here. So what do you do as a healthcare strategist?
I gave myself that title about 3 years ago because I realized as an insurance advisor, the true problem is not insurance, it's in healthcare and the cost of healthcare. So what I found I was doing was spending the majority of my time helping my clients solve the cost problems within the healthcare system. So at that point, for me, it was a title I gave myself to differentiate myself from the broker community and truly let people know what we're trying to solve.
Okay.
We don't have an insurance problem, we have a supply chain, a healthcare problem.
And you're seeing problems really specifically with the design of healthcare plans,
Absolutely.
Is that right?
Absolutely.
In what way are there specific problems?
I would say right now one of the fundamental issues I see in health plan design is employers are building a health plan through an insurance carrier. And they're relying on the insurance carrier to navigate or manage what we call the supply chain of healthcare, right? And unfortunately, right now, there's too many revenue streams and misaligned incentives within that relationship that what's feeding out over on the workforce is overinflated charges, unnecessary procedures, and ineffective treatment plans. And you have a workforce that's not only financially stressed out, they're frustrated.
Okay, so where to begin to even design something that is addressing some of those issues?
Yeah, good question. I would say I always use the analogy of building a health plan backwards. And so instead of starting with picking the carrier and building a health plan that way, I think we have to start with the workforce. And we have to focus on how they're interacting with the hospitals, the outpatient surgery service centers, the pharmacy, and primary care, and implement solutions that allow the employees to access high quality care at little to no cost. And then when you find the right provider, right TPA that's going to allow you to do that effectively, that's how you create a value-based plan design.
And are you finding that people are understanding this better, or do you think that it's challenging also to get people to change what they've been doing all along?
Absolutely. Change is our enemy, I think, in the industry right now. You have decades of employers who've been told to do it a certain way and have been told that this is all you can hope for. And so I always tell our broker community, it's time we have to start selling stories. We can't just sell products anymore. And I think that comes from the fact that we've been told or trained for so long just to sell a health insurance product. But again, that's not solving the real problem, which is the cost inside the healthcare system.
Well, what's the story then that should be sold?
Absolutely. You got a workforce right now living paycheck to paycheck. We're providing these health plans to employees that we think is a benefit. Well, when you look at what the out-of-pocket limit is and you couple that with the premium contributions employees have to make, today that can equate to 15-20+% of their gross take-home. That's not a benefit anymore. And so the true health plan design to me is focusing on how that employee is interacting with the healthcare system and allowing him or her to access the right care at little to no cost. So making the right decisions at free or near free. That's how we're going to get engagement, and that's how we're going to start putting money back in employees' pockets.
Is there any good news? Are you seeing some companies that get it and
Absolutely.
Have a great example that you can share with others?
Absolutely. That's the beautiful thing about what we do. I always feel as an industry, and I say the industry being brokers, I don't think we can solve the entire healthcare system issue that we have in this country, but we can absolutely help solve it one employer at a time. And so if you've got the right employers that are looking to get outside the box, they're looking for different solutions, they're done with what they've been told are less bad rate increases, and they're willing to do the right things to allow employees to interact with the healthcare system appropriately, knocking 20-25% off their health insurance cost isn't out of the equation whatsoever.
Okay,
but it
great.
requires them to understand change is needed, and they're willing to do the work to put in that change.
Thank you for that. How are you finding the conference so far?
Absolutely, it's great. It's what I love about the conference is you have a mix of employers from 10,000 plus employees all the way down to employers who provide health care to 50, 75 employees. And I always think the beautiful thing in our industry is employers in this country have the same problems with healthcare, whether they have 50 employees or 5,000. These folks just tend to have more zeros in their budget, but they have the same underlying problem, and that's their employees are not interacting with the healthcare system the right way.
All right, Andy Neary, thank you so much for stopping by.
Absolutely.
And I'm Mabel Jong. Stay tuned. We have many more interviews to come.